Hi, so here I am presenting a case of TMJ study. So let's look at this case. So this is the patient who is 37-year-old female patient, and she reports with a pain in the right third molar region. So the patient is referred to the oral maxillofacial surgeon for the extraction of the third molars, and the surgeon took a CBCT scan just to review the dentition before performing extraction of all the wisdom teeth. The scan was sent to oral maxillofacial radiologist for a read and a detailed report. So here is the scan of the patient, and you can see on this panoramic image all the third molars are erupted except for the tooth number 16, which is missing. Overall the dentition looks good except for generalized mild to moderate horizontal bone loss in all the teeth. So that looked very fine, and when we looked at the whole scan, certainly there were some more incidental finding of mucosal thickening, calcified stylohyoid ligament, and then there was the reduced pharyngeal airspace because of the retruded soft palate or the tongue mass. So certainly that could be a case of sleep apnea and need further review to establish whether the patient is actually the case of OSA or not. But when the oral maxillofacial radiologist was reviewing the report, I happened to look at the temporomandibular joint, which is an essential part of looking at the whole anatomy, which is captured in the scan, and this led to the discovery of some of the changes on the left condylar head. As you can see here, there's a low density region at the anterior medial region of the left condylar head, and there is a subarticular sclerosis. Cortical outline looks a little bit eroded here. There's a superior anterior position of the joint in the sglenoid fossa, leading to the reduced intra-articular space between the joint component. So this was an interesting incidental finding because that led to the diagnosis of moderate degenerative changes at left temporomandibular joint. This is the case where the OMFS took a proactive step and led to a collaboration with the oral maxillofacial radiologist, which definitely led to the timely diagnosis of the root cause of the problem that the patient was experiencing. So the proper treatment was rendered, that is the extraction of all the third molars, and along with that the treatment of the degenerative changes in the TMJ, and that led to the elevation of the pain, and the patient was certainly a happy patient here.